I think we are going to start because we are a little bit late. I hope all of you are enjoying the European Digital Health Summit, and you enjoyed yesterday the first day of our summit, in which we have the opportunity to have with us some politicians, also Marco Marsella from the European Commission, and the outstanding keynote speaker, Escobajo. Yesterday, we were more focused on strategic level policy and big ideas, let's say. And today, we need to materialize what we were starting to think of. The brainstorming that we did today, now we need to start thinking on how we do in Europe an action plan to make it happen, how we implement policies to make this a reality. But let me remind a little bit what we did yesterday. First, I think in the session on AI, we discovered that AI and data can transform healthcare. Only if we ensure trusted access to high quality, sorry, I do not see very well now, data set, protect citizen rights, and redesign workflows in a way that healthcare can be implemented. So healthcare should be at the heart of the AI strategy. We need to facilitate market access to do pilots and to implement many different solutions of AI in the healthcare sector. So second, we also were hearing yesterday a lot about the resilience and cybersecurity and how it is important to have cybersecurity in the health sector at local, regional, national, and European level, and how it has to be coordinated in a way that ensure we are a more resilient health continent, let's say, or region. Then, and as a third insight from yesterday, I would say that in the industry dialogue, we also heard that cybersecurity, funding models, skills, and digital skills are not really side topic, are still key for Europe. So they are the foundations to make patients and more satisfied, to make regions work better, and to offer better services for all. So I want to thank to all of the moderators and speakers yesterday to really the high performance that they did. And I want to also thank you, the speakers and the people that has been contributing to the European Digital Health Summit. And today, we have an agenda in which we will go into action. The Master of Ceremonies for this room will be Madalena Hilario, and we have another room because today we are working in parallel session. And the Master of Ceremony will be Anderson Carmo. Then the agenda for today really will be in the morning, we will have a number of parallel sessions. Then we will have a light lunch, and after that we will have the Latin American chapter. So I want to pass the floor to Madalena and enjoy the day and all the parallel sessions. Thank you.
So, good morning, everybody. I'm pleased to be the Master of Ceremony today, and welcome to the session A1 on European Electronic Health Record Exchange format. Before we continue, just a brief practical note. This meeting is being recorded and photographed, as indicated in the privacy notice included in the registration process. By attending, you consent to being part of the summit's visual materials. I hope you will stay after this note. And the organization will use selected excerpts to prepare short highlights videos capturing the key messages of the summit, as well as the general report that will be published and disseminated in upcoming weeks. If you share moments on social media, you are very welcome to do so, and please use the official hashtag EEHRxF25. Now we begin. As you know, the European Health Record Exchange format is a cornerstone of the European health data space, but adoption across member states is still uneven. This session will look at readiness level, governance challenges, and strategies to harmonize progress with practical insights from European and national experts. I am pleased to introduce our moderator, Gianluca Violante, Senior Manager for Digital Health Policy at Digital Europe, and the panelists Fulvia Raffaelli, Miguel Angel Montero, Robert Stegwee, and Michael Johansen. So Gianluca has been closely involved in policy advocacy and stakeholder engagement on digital health, interoperability, and data governance at EU level. He supports coordination between industry, policymakers, and other relevant stakeholders to accelerate the implementation of the EHDS across Europe. So I thank you so much, Gianluca, and please join me in welcoming the speakers on stage. Thank you, Gianluca.
Thank you. Thank you, Maddalena, and good morning, everybody. Welcome to this session. Before we begin with the session, just a quick introduction. My name is Gianluca, as said, Senior Manager at Digital Europe, and I look forward to moderating the session on the European Electronic Health Record Exchange format. A bit of a mouthful, so I'm going to call it the format. As said before, yesterday we had discussions on high-level strategic visions, but interoperability did come up as a keyword. So what we will do today is looking at how basically the format, which is a very technical and yet fundamental topic within the European health data space, can help us to achieve the vision of the regulation. So we will explore member states' current situation in implementing the format, the progress that has achieved, the role of the European Commission in helping with the implementation and harmonization, and we'll also hear industry perspective. Again, we heard a lot about public-private collaboration yesterday, so we'll do that today as well. And ultimately, the goal is to understand how we can move from fragmented to a federated and truly connected digital health ecosystem. So with that said, let me finally introduce the speakers of the session. So we have Fulvia Raffaelli, Head of Unit of Digital Health at DG SANTE, the European Commission. Fulvia joined the Commission in 2002, and since 2022, she has been working in the unit responsible for the European Health Data Space regulation. So she has been leading the project of basically building and realizing the EHDS. We have Robert Stegwee, Chair of SANTE 251. Robert is one of the foremost experts in health data standardization. He's chair of SANTE 251, where he coordinates the development of technical and semantic standards for health information exchange, ensuring interoperability frameworks, which are, of course, crucial also for the format we will be discussing today. His work bridges technical and practical usability of healthcare IT, and he's part of the SANTE, so the European Committee for Standardization, working specifically in the field of health. We have Michael Johansen from Denmark. He's Chief Consultant at MedCom. Michael has played a key role in the Danish building the Danish digital health architecture, which is, of course, one of the most advanced in Europe. So at MedCom, which is a publicly funded nonprofit organization that supports the Danish interoperability, to build Danish interoperability and work across sectoral data exchange, EHR, and again, building the national readiness for also on of course, the EHDS. And finally, we have Francisco Lodogno. He is part of the Digital Health Commission at Ametic. Francisco is a biomedical engineer and digital health specialist, and where he contributes to European initiatives on data spaces, interoperability, syntactic data generation, and he has a PhD in biomedical engineer from engineering from Ghent University and has participated in a number of projects on FAIR principles, data-driven architecture, and such. His work advances secure platforms and innovative digital solutions that support clinical research and personalized medicine. So, round of applause and welcome to our speakers, please. So we'll do a first open icebreaker question to all of you, and then we'll try and also see, we'll have more general questions that hopefully all of you can share some insights on, and then if we have time, we'll open to our audience. So Fulvia, let me start with you. So from the European Commission perspective, what is your view on how the European Electronic Health Record Exchange format helps to lay the foundation and achieve the vision of DHDS, and what support mechanism has the European Commission also can put in place to help coordinate and harmonize the implementation in the member states?
Well, good morning. First of all, thank you, Gianluca, for the introduction. Well, the exchange format, the format, is the core of the European health data space. It's the language, is the Esperanto that we're going to speak here together so that we can understand each other and exchange data, but where data are very practical information, very practical elements of our health history, and where those says a lot. I mean, these are really about information which are critical in hospital and in emergency situations. So the exchange format is really at the core of the European health data space. It's based on a recommendation that we issued already in 2019. At that time, it was at the foundation of the voluntary system, the one that exists today, so the My Health at You, and we gained already quite a lot of experiences in exchanging and in defining with the e-health network guidances the first step, let's say, in the exchange of data across different member states. This remains a very, very fundamental reference for us, this experience that we gained in the voluntary system. And today, it remains, let's say, a point of reference for all the member states and the stakeholder looking at that experience. Let me say, the format has three main objectives. The first one is to define the common content core. So what are the minimum set of information that can really, the minimum set of structured data that you can really exchange in key clinical documents, and providing the minimum information that you really need in clinical setting to get and ensure a continuity of care across the different member states. Then the second objective is to align semantics and technical specification to make that happen. Because building on the e-health network guidance, the format will link the information models, terminologies, and technical profiles so that a patient summary result or a medical test result is interoperable. And when I say interoperable, is really interoperable across the whatever is used in the EU. And finally, the objective of the exchange format is also to bridge between the national system and the digital infrastructure that we are building at the European level, so to make this cross-border exchange possible. We are working full speed, and Robert knows that we are really building upon the experience that we have into the My Health at EU, so the voluntary system, but also the joint action, which is a project that brings together all the member states to really get their experience in that context. We have no intention to reinvent the wheel. this is clear, something we are very clear in mind. We don't want disruption on the market, quite the contrary. We want to build upon what is existing and what are the experiences that have been accumulated across the member states. The last point to say that, of course, we have several initiatives ongoing to support member states, but also the other stakeholders in getting acquainted with and prepared for the format that will become mandatory from 2029 on, but for which the technical specifications are being decided in these days, and the implementing act is expected before March 2027. And those actions goes in training, formation, setting up also now recently common center for the support, common supporting center for the exchange format in particular. And of course, we are very much in contact with many players, also from industry side, to multiply and to spread the gospel about the importance of the exchange format.
Thank you. Thanks, Fulvia, and thanks for also aligning the three objectives of the format on the content, the semantics, aligning semantics and specifications, and bridging between the national and EU level. So, moving on then onto Robert. In your view, how what are the critical where are we with the standards and specifications that we need to achieve what Fulvia just outlined?
Yeah, thank you for this question, and thanks to the organization Digital Europe for inviting me here. It's been a pleasure. We have been working for quite some time. Actually, if you look at the timeline of what standards organizations have been engaged with in this field, starts with the EPSOS project in 2008, the large-scale pilot that was created to test out cross-border exchange of patient data. And that laid the foundation for the voluntary system that Fulvia just talked about. And we've taken that on first as just contributing our standards knowledge, and then also taking the topics to the standards world. So one of the most important and most important learning experiences has been the International Patient Summary. It was created based on the eHealth Network guideline for the patient summary. It was taken on by SEN as a project to turn it into a European standard, together with HL7, together with SNOMED International for the terminology, and later on also IHE came aboard to actually provide the testing profiles. So it is indeed what Fulvia mentioned. It's several layers of format and specifications that you need to take on, and there are several standards organizations that take care of that. So SEN is really at the more conceptual level, and together with ISO, we now have the International Patient Summary, the 27269 standard. But it is closely linked to the HL7 implementation guides, both in FHIR and in CDA, and it's linked to the IPS terminology that SNOMED provides, which is a subset, so that if you need to translate parts of an international patient summary to your local language, that's exactly what the countries, the member states can do, and that's of course built upon the example from EPSOS, the Master Value Set Catalog, where you have a limited set that you need to translate across borders, because if you have to translate everything that's in SNOMED, that's just too much. So, and you don't need all that detail. So we've been working together quite intensely with these standards organizations, and we've now also at the European level are bringing this collaboration to support the format and to support also the member states in the implementation of the format. So we're also linking, of course, with our national standards bodies, with the national affiliates of HL7, with the national release centers for SNOMED International, and with the I never know what IHE calls their local members, but they also have their national groups. So we're all working together, and we're supporting governments. We're supporting. We've been working together in all the projects leading up to the format. So the XE Health project, ExpandEH, and others. And in the EEHRxF project, we're now creating what we're calling the hub, where we bring together everything that we know on creating the format, what the format could look like, what you need to do to actually prepare. We have 8 adoption sites across different countries that are actually testing out what it means to implement this. And that feeds back into the specifications, so we can actually maintain the specifications and make them better, so that we can offer them to XEHR and to the committee where the Commission and the member states together are preparing the implementing acts. And that's what we're doing, and we hope, of course, that our proposals, that together with the joint action that we're preparing, will be ratified through the implementing acts, so that we can move on and keep on supporting the implementers, the industry, the hospitals, and the national e-health centers to actually create the national infrastructures and make sure that what needs to be done actually gets done.
Thank you. Thanks, Robert, and super, quite insightful to hear that this is a project, something that has been indeed going on since 2008, and thanks for also aligning the standards set by the International Patient Summary, and how you're connecting the dots also with the different joint actions and projects that are ongoing, such as EXpandEH, EEHRxF, and Extended EHR, and such. And as you pointed out, of course, moving on from to the perspective of the member states, maybe Michael, if you could share Denmark's experience, which is of course a quite advanced country when it comes to digitalization. What sort of steps have you taken and to implement already the HDS and achieve interoperability in Denmark, and of course with aligning with also the requirements of the HDS.
Thank you. I'm very happy to be here. Thank you for the invitation. I come from MedCom in Denmark, and we see ourselves as a standard organization. But in reality, we test and certify everything in Denmark, and as well, we are an implementing organization. So we try to implement the standards as well. So we have experiences in different angles. I agree with you, Robert, that a documentation of the standards is not sufficient. So we have always tried to have a close relationship with all the stakeholders. We cannot make a standard and implement a standard without having spoken to all the stakeholders. We need a close connection to the industry. We have to have a close connection to all the clinical associations, all the users, and also when the application is for the citizens, we have to involve citizens. Do they understand these new tools? We're being punished in Denmark because we started early, so we made some Danish standards, and we understand them, are happy about them in Denmark, but they cannot be used anywhere else. So 5 years ago, we made a strategy to make a transition away from all our existing Danish standards into HL7 standards. So the last 5 years, we have profiled new standards and make new versions of existing standards only in HL7 Fire. So that's our early preparement for a new exchange format that we have to teach the vendors to implement in fire technology. Everybody in the industry is very happy about fire and say, this is easy, give it to us. But in reality, it's not that easy and not that fast to implement. And that's also the learnings from HL7 International, that's one of the big obstacles globally, that there's not sufficiently software engineers who can implement fire standards. So if you're not started on fire, get going. Implementing a new technology for a vendor is not a topic for a month or two. It takes typically a half year to a year to to train and get an expert in this field. So we look into modernizing the Danish standards and where we can substitute a local Danish standard with the format. Instead, we have a lot of national databases containing lab reports and prescriptions and discharge reports. We have everything stored at a national level, so everybody have access to everything. But these local standards for uploading all types of data should be substituted with the format. And possibly we will have to talk about the format plus a little extra, which is needed for the local requirements in each nation. But the majority of the information could be exactly the same when we share them cross-border and also cross sectors within our own country. So that's our strategy, and that's what we are preparing for to do. But we are a bit, we are struck. Next year is going to be a very busy year in Denmark because we're going to have an election for parliament next year, we know that. And we also have a big health reform taking place. So we're not quite sure, is it the municipalities or the general practitioners or the hospitals who are going to take care of the patients. So lots is going on, and we're very excited how we're going through this very interesting year.
Thank you. Thanks, Michael. And yeah, it seems that starting early is not necessarily always the key. But thanks for outlining the key actions in Denmark. And of course, you mentioned stakeholder, also collaboration and speaking to different stakeholders, and going on to Francisco. I'm curious to hear the perspective of an industry association such as Ametique, and how do you see the format, but also how do you see the collaboration with between private and public sector in realizing the implementation of the format and of course the HDS.
Yeah, well, first of all, thank you very much for having me in this panel. I think it's fundamental, this kind of communication, and that we have different perspectives and we can collaborate between each other. And this is a key point that I want to come back later. So related to private and public sector collaboration, I think it's fundamental for get ready to implement the format and to be interoperable and be able also to share data across all different member states. Let's say I'm going to start a little bit on the experience of Spain. Spain has, let's say, a leadership related to the digitalization of the EHR and also in a prescription. So that's the positive side. The part that is a challenge still is related to the standardization and the structure and data quality, because there are not like specific checks for that part. And the situation of Spain is also particular in the sense that we have different healthcare systems, specifically 17 from each autonomic community. So there are, like, let's say, fragmented experiences. And that could be a challenge, but I think it's also an opportunity. Because at the end of the day, we have a central, let's say, government, and it is possible to have a consensus of what needs to be done. And then afterwards, each community can, let's say, open a call. And then you can have different perspectives and different approach to solve the problem. That could be a challenge in the sense that at the end of the day, maybe it's not that easy to get to the same place, but it's also an opportunity in the sense that you can solve the problem and maybe see the experience of the other, let's say, communities, and then get the best approach and get also lessons for all the communities. And as also Michael was saying about Denmark, it is true that it's maybe challenging to be the first one, but it's also enriched for the other member states, because you can share that lessons with the other people and with the other communities and with the other countries. And then from those learned lessons, it's going to be easier for other member states or for other communities to arrive there. So let's say the part about the, let's say the leverage between public and private sector is this opportunity to do innovation let's say, with the private sector through the guidelines of the public sector. So I think it's fundamental that we work together, and like I said at the beginning, that we communicate, that we understand what are the needs in the, let's say, in the healthcare systems, and then we can solve through innovation and to apply, I mean, all the resources that we have in the private sector into the necessities, the actual necessities of the public sector as well. So I think that that's, let's say, a strong collaboration, and that's a key element of the preparedness and readiness for the interoperability.
Thank you. Thanks, Francisco, and also for sharing the experience of Spain, and sharing your thoughts on how to foster public-private collaboration and filling some of the existing gaps, as you say. I'd like to now move on to a bit of a more dynamic discussion and hear your thoughts on a couple things around how we realize some of the the format, some of the things that you've presented. So starting on a broader question around, of course, digital maturity. There's, you sit here and represent and have experiences from different member states. So I'm wondering, when it comes to digital maturity, how across member states, how can we make sure that member states are brought to the same playing field ahead of the EEHRxF application, what role the Commission has in doing that, and some of the barriers perhaps that you see in achieving that. So I'll start maybe with you, Fulvia.
Okay, good. Our role, Commission, is to push. push everybody to get a common view on that, because this has been a sort of a dream. When I speak with many also manufacturers in the area, say, "But are you really make it an interoperability?" Yeah, we say, yes, we do it. I mean, at least that's the idea. So we're really pushing everybody, and in particular member states, to make a very important assessment of the existing, so what they have in-house, how they would indeed need to change versus something, so to really look at the different options they have, because this is crucial. We have indeed member states which are very different level of maturity. There are some like Denmark, they have invested a lot, are our pioneers, the ones that have a lot of experience there, but they may need then to adapt a bit if the final. And then there are the ones which are starting from much lower level, and they are kind of waiting and see what's going to happen at the EU level to actually move directly in this direction. So it is very, very differentiated. We're working with all of them, and with the joint action, we providing also direct grants to the different member states to work and to engage into the technical conversation. We are expecting the joint action to get to the final deliverable beginning of March, while we have started the conversation in the EEHRxF committee, so a political level, really to ensure this connection between the political level and the technical one. And we're very grateful also to the different stakeholders and the different standardizers, which are really providing very technical input and support to the joint action and to the deliverables, to that conversation. So we try really to get an open and a transparent process, so that all the different let's say, sensibilities can take into consideration. Then there will be a decision, and there will be 2 years to actually ensure that that decision is implemented. Just one word, which I would like also to say on Denmark. I think they are going in the right direction. The one we're thinking of having the same information that goes from national to the cross-border, because it would be really, really a lost opportunity if we would have had different national boxes that then only communicating in an artificial way for the cross-border one. So that this, I think, it would be really, really a lost opportunity. So that's, I'm very, very grateful.
Thank you. Thanks, Fulvia. Maybe Michael, do you have anything to share here?
No, I quite agree, and we have rather a lot of integrations in Denmark, which we have to transform, and we had a timeline, approximately 20 years to do this, and now some of it has to be implemented in 2 or 4 years, so it's a bigger task than we anticipated. But I quite agree that we need to look at all the old stuff and old integrations and slowly change it for the international standards. And we see a great benefit in when you create the data and you use them for primary use in a EHR system. We can reuse the same format when we upload to a national repository, or if we share them cross-border to another country. So the secondary purpose of data can use the same data in the same format. I know there's extra data needed in secondary scenarios, but much of the data can be reused. So we do not, as a vendor, have to implement different integrations and mapping between these formats. So it's a much easier implementation, and it also is good for the quality that we do not have these extra mappings. Whenever we map, we tend to see the small lack of quality around.
Thank you. And maybe Robert or Francisco, do you have any thoughts on this point?
Yeah, I think I'd like to mention that already in the XPNDH project, we developed a maturity survey, both for vendors and for institutions, and that has been used also to provide an overview of where do we stand, also at a member state level. The European Commission has done a lot. I know that within the EEHRxF project in Priojects is also doing a lot of work on that. So we are doing quite a lot, but we need to make sure that it doesn't remain at the survey level. We really need to turn it into action. And that's where we want to help from the hub that we're creating within EEHRxF as the standards organizations to actually plot that course. If this is where you stand, what do you need to do, and what could be the order of things that you need to do as a member state or even as a hospital. And that's being taken forward also in the I2X project, which is a Digital Europe project demonstrating the use of the format. Even though the format is not there, we're demonstrating what could be done. And I think that's key, and I also hear that from Michael, that it's key in not looking at the format as an obligation, but as an opportunity. And we're really looking at how to identify what are the business use cases, what are the opportunities to actually move forward and have an advantage and innovate healthcare through the use of the format. Because if you just say, well, this is what we need to do and we'll just do it to tick the box, that's not going to happen. That's not going to help. And I think that was also the message from yesterday. That was very clear. One more thing I'd like to add is that at the national level, what Michael was saying, we do have experience with the International Patient Summary, that there's nations that adopt the International Patient Summary but have to tweak it to their national level. And we do know how to make that connection between the national level, even the local level, because in Canada, every province and territory have their own slight variation, but we know how to keep them together and to make sure that anything that's needed at the lowest level can bubble up to the international level and can be maintained there and come back in the next version of the International Patient Summary. So that's something that we also like to offer to member states. If you're looking into a national variation or a national edition on the European Patient Summary, on the e-prescriptions, on the all the 6 parts of the format, then we're there to help you make sure that you make the right choices and you stay interoperable, even at the global level.
International. Thank you. Thanks, Robert. Quite interesting to hear. There's indeed an additional layer there to an international dimension. Francisco, do you have any thoughts to share?
Well, let's say just one small barrier that I mentioned before. I think it's important to take into account the fragmentation of the readiness of different regions, for example. In this case, I think that there is one specific barrier that I think is important to take into account, is that we still need to have, let's say, this standardization and the selection of the standards that we are going to use, in the sense that from the private sector, I mean, we can have a lot of solutions, but then we need to speak with the public sector, which are going to be the guidelines for those solutions, which are going to be the ones that apply, and how we can arrive to the interoperability of this data. So I think that that's one of the greatest barriers that we have to overcome, and also an opportunity, let's say, also to move forward and to be able also to share data across different member states.
Thank you. Thanks for that. And I'd like to explore a little bit more the idea of you've touched upon public-private collaboration and partnerships. Collaboration, I think, one of the key words that also came up in the conversation yesterday. So I'd like to dig a little bit deeper on what that means. And there are indeed, you mentioned yourself, many different joint actions and projects currently ongoing. I'm wondering, how do you see these public-private collaborations to be taking place? What sort of gaps can they fill, and where do they fit in sort of getting ready for the format and DEHRxF more generally? Maybe I'll start with you, Francisco.
Thank you. Well, I'm going to recover a conversation that was held also yesterday, because it was something interesting, not only because of the discussion, but also because I hear it before in another forum. And it was related to, for example, the gaps in the primary services. Yesterday was mentioned that there were like 3 or 4 hours or more hours in which, let's say, caregivers, they have to type or digitalize a lot of information. And then you have 5 minutes with that caregiver. And instead of using more time with the patient, you have to go to the system and to digitalize that. And I remember one conversation in one specific forum that was saying, it was healthcare providers saying the same thing. They were saying, it is great that we are talking about so many applications in AI, amazing things that we can do, but then we have these small gaps at the caregiver, let's say, level that we are not filling. So I think one of the first strong points that we can make is that if we know exactly what are those gaps, even if they seem small, we can improve a lot of the systems. So if from the, let's say, the private sector, we know that that is a solution that is needed, that we can provide, and even if it seems simple, we are going to make the system work better in a lot of sense. So for example, to have a system that can digitalize automatically and that can give the caregiver more time with the patient, I think that is a leverage between the private and the public sector that is going to improve a lot of, let's say, in the general, the system. And bringing this into the conversation today about the readiness, then if you do that small step, that is going to improve the caregiver time with the patient. That is going to improve as well the interoperability, because you have the first step, which is the digitalization. And maybe if you go a step further and you think about a solution in which you can map into a standard, then interoperability is kind of not solved completely, but you have a big step into that. So if we hear, let's say, the needs in the sector, in the public sector, then we can solve them. And we can do something that it seems like a small step, but it's going to be a big gap solved for everybody.
Thank you. Thanks, Francisco, for the insights there. And I'm wondering on what is your perspective, Michael, on this topic? As you know, Denmark is indeed ahead, and there is quite effective public-private collaborations there. So I'm curious to hear your thoughts.
Yes, we have a number of vendors who have systems running in the private sector and as well as public hospitals. And the technical implementation is rather the same. It's not a big problem. We have contact to all types of vendors. The real problem is funding. How do we raise money for this? It's easier in the public sector, but in the private area, it's sort of a general practitioner or a dentist which has a private clinic has to pay for this to their vendor for this implementation. And this typically takes years in Denmark before they can agree upon. If we get an extra salary for our encounters in a clinic, we will, at the other hand, implement and support this format. So that's negotiations. We take them twice a year, or no, sorry, for each 2 years. So that can also be a sort of obstacle for the implementation in the private market. But I think that the really important word really is capacity building. We need to gather people and learn from each other, and not forget small vendors in the private market. It's not sufficiently to make the best format in the world and put it and publish it. Each vendor interprets in their own way, and we can see a lot of different interpretations if we do not explain how to implement it in a common way. And I think that's a task for us in Denmark to explain to the vendors in Denmark, but we also have to share in the European Union, so we implement the same way in each member state.
Right. Thank you. And Robert?
Yeah, I really relate to what just has been said. I mean, if you don't implement the standards, I mean, ISO is full of beautiful standards that some of them don't get implemented. So I really relate to that. And what we need to do as well is look at, and that's the perspective of Francisco, how do we actually make sure that the data is there? We heard it yesterday, if the data is not there, AI cannot do anything. The same thing holds for the format. If the data is not in any system, there's nothing to exchange. So we really need to make sure that we don't focus too much on the exchange, but also take into account how does it actually get created and how does it actually get accessed in the clinical sense. I really loved the contribution that CPME made on the EHDS, really focusing on how does this help the patient professional encounter, and how does it show up on the screen. And that's where we really need to work with the industry, because the industry needs to make it real for the patients, for the professionals, in real life, in everyday clinical life. And that's something that we try to add to through some of our experience in usability standards, and trying to add to the testing of the format that we're already doing also in the IHE Connectathons and through the EEHRxF project. We try to add usability to actually showcase how do you do this in a clinical sense. Because if it doesn't work in a clinical sense, it's waste of time, money, and effort. So that's what we really try to do, and why we really need to work together with the industry, and that's what all standards organizations are doing, working together with the industry at the local level, at the European level, at the global level.
Thank you. So yeah, keeping in mind sort of the end user, ultimately the professionals and the patients. Fulvia, any thoughts here?
I mean, I can fully subscribe what has been just said, because the actual interface, in the daily work, what a GP, what a nurse in the hospital will see is an interface, which is a vendor software at the end of the day. I mean, the hospital will make its choice, the categories will make its choice. So the industry is really the one that can get to the final user. They better understand what the user needs are. They mean, they have their mindset in doing such. So they are the industry here is the engine that can really roll out and make of the exchange format the facilitator, let's say, what is going to make simple for a GP, but for the whole system to gather data which are of good quality, and then to make those data, of course, manageable and usable, let's say, both in terms of care treatment, but also in terms of research of innovation. So I am a stronger believer of the partnership that we can have with industry, and I think that the HDS was somehow visionary in having also this element of internal market that brings at least starts, let's say, of course, in the respect of the needs of the member states to have, as you said, the format plus if needed. But I think it is by introducing at least a starting point for the security and the logging component in terms of authorization and CE marking. I mean, it pushed also the EHR system manufacturers to invest in the format. So everything starts and ends with the format, because it's what it can make of the HDS something that really get this objective of connecting dots, really connecting and making this data that we are all speaking about really usable in clinics, in research, in innovation, for AI, and for all these different uses, and for the other uses that may emerge in the coming years. Because I was saying before, I mean, a couple of years ago, we never heard about, or at least we were not focusing at all on AI. Now everything is there. So maybe in 2 years we'll have another. So it's important that we have a common basic language that we can speak all together, so that we are also ready for the next steps, let's say.
Thank you. Thanks, Fulvia. And I'd like to, I believe, tell us some time to ask questions from the audience. So maybe I'll see if there are any questions. Yes, please. I see one question there.
I'm also involved in the EEHRxF project, just as a disclaimer. So I have a question for the panelists. In my experience, many stakeholders, both on member state level but also in industry, might not know the format as a brand. But if you tell them what the likely standards are that will be part of the format, because although the implementing acts are not out there, some that are very, very likely to be part of it, they know, yes, and we know this and we're applying this. For example, 2 weeks ago, I was at a Medica trade fair in Düsseldorf, one of the biggest medtech trade fairs, and people talked a lot about HR7, but when I talked about the format, people didn't know what it was. We also have the experience, similar experience in some member state contexts in our projects that we do. So do you also have this impression that the brand format is not yet so fully recognized, but that its components are?
Thank you.
Yes.
Thank you. Thanks for that. Any reactions? So I see Fulvia, please.
Yes, because the format, it doesn't exist yet. I mean, in terms of legally speaking, this is the work we're doing for the member states, with the member states to prepare this implementing act. We've been moving the first steps, but that's it is so for the time being. The format in the legal terms, it doesn't exist yet. So we know that this is, of course, is going to build upon the existing standards. These relevant, very relevant international standards are fully in our radar screen. But what is going to be the final, result is yet to be seen. And so we need also to be. This is also a conversation we're having with the new association. So we need to be clear on the fact that as of today, is this reference, the exchange format for the HDS in legal terms, it doesn't exist yet. So if you want to, you can invest in learning in what is likely to be. So what are the elements that would certainly be at the core of that format, But again, we need to be careful on the fact that the final version of it will only result of the implementing act. So there is also an issue of communication here that is important, so that you, when testing the very relevant, when going into the very relevant experiences that have been organized by the different standardizers, which are crucially important to train, you also have in mind that this is not yet the final agreement. This will come with the implementing act, as I said, before March 2027.
Thank you. Yes, Michael, please.
Yes, we hear the same questions especially from the industry. What is a definition of an EHR system, and the components for communication and logging? How are we going to implement in our system? Because we have already existing communication and logging modules. So do we have to implement two, or can we combine them? There's a lot of questions from industry, and we participate in a European network called EFL, and we debate these things. Where can we find some problematic issues or blind spots even to see where do we see difficulties implementing this EHRxF. And I think next week they will publish some working papers with the aim to debate it in Helsinki in January. There's an EFL symposium at the same time as the Radical Health Festival in Helsinki. So that's a good place to be to debate these issues, and the result is to come with some recommendations for the Commission.
Great, thank you, thanks.
Can I add one?
Yes, please, Robert.
I think the question about what's the format and the visibility, I think EHRxF is even something that people need to understand. And I've been made aware of an initiative within the HL7 community where there's now a course being offered, EHRxF on Fire, trying to explain what's in the EHRxF that's relevant for EHR vendors and implementers that relates to fire, and how does it all work together. So that's some of the capacity building that's being addressed through the HL7 affiliates in different countries. And I know from the HL7 Netherlands is offering this course in April for the first time. And also, of course, in-house training for those who cannot wait for the official trainings.
Right.
So there's several HL7 affiliates across Europe that are offering this to make that link, and of course the format will be a part of that training as well. Right. But it's not being portrayed as this is about the format. No, this is about EHRxF on Fire.
Right, so educational training. I think there was, unless there's any other remarks from others? No? Then maybe there was another question, I believe, from the audience. Yes, please.
Hello, good morning. My name is Peter. I'm with Merino Software, and we're both in Spain and in Ireland. Very happy to hear what Michael said, because we only work in fire. And the one experience that we've made, I would like just comment one thing in my question thereafter is, we've noticed that, of course, there's a lot of unknowns about what the final rules will be on a European level in the nation states, but to us and to the partners that we work with, both in private and public industry, it seems very clear that fire is going to be the engine that drives, or at least a very important component of the engine that drives this process towards true interoperability. I would like to request your response to that on the one hand, and then something that Francisco said. We've done actually quite a couple of projects where the client, the hospital, or even in public sector, responded to us saying, well, if we use these standards, then we can reduce your time of doing a risk assessment in thrombosis, by 50%. And that's why then they made a decision. So they, by default, making a decision towards interoperability. And I'm also a very proud member of the EEHRxF community. And I've got a question. My real question is, how can the experiences that we're making in the private sector, where we indirectly are working on the base standards that are going to become the format? How can we feed that into this process? Because we feel lost in a landscape that is very complicated for us as just a normal company.
Thank you. Thanks for the question. Any reactions? Anyone who would like to respond?
Well, maybe from a standards perspective, I really liked the three words that were mentioned yesterday: standards, integration based on standards, and collaboration. And that's what we're working for. We do have the feeling that the FHIR will be the future. We do have, of course, the EOF network that has said already before the EHDS that everything, all new chapters in MyHealth ATU should be based on FHIR. And we have a legacy. Like Michael has a legacy in Denmark, Europe has a legacy with the CDA implementation of the patient summary and the prescription and dispense reports. So, we're ready to make that happen in FHIR. We, as part of the tooling that we're providing from the EEHRxF project and through through ESHA, once the project is done, is the CDA to FHIR conversion for the patient summary and for the e-prescription and dispensation reports. So, in our view, yes, the future will be FHIR. As Fulvia mentioned, we are talking to the Commission to help out and to support them from the EEHRxF experience. So it may not be visible to the individual industry participant in EEHRxF, but we are working to bring all the experience from EEHRxF to the EHDS and to the European community. IHE, HL7 and SEN are also supporting the XTHR joint action. We've been commenting on the reports, and we've been discussing them within EEHRxF. So yes, we are very much playing with everyone to make this a good game and a good result.
Fulvia, please.
So I'm not going to enter into the conversation of FHIR CDA because this is the matter that we are discussing in this day with the member states. But what I would like to say, as a company, as a, let's say, private investor, I think you have an interest to get connected with your own national authorities, the national system. Many member states are engaging, or having groups of stakeholders, engaging with that dialogue. Not all of them, but many have this dialogue with the private sector. Is there where you need also to feel your needs, because health is a very particular domain where public is very present. Investment, money comes in big percentage from for public funds, and they have somehow their own logic. They are not necessarily super related to the more, let's say, industrial vision or income. So I think when digitalization is still an area where also member states needs your vision, because they are very big experts, very people of visions in the administration, but at the same time they are not the expert of the matter. So I think that it would really be important that you play with the national authorities to make it for them understanding what are the needs, how can you play to support the transition, indeed potentially from legacy to new. So what are the opportunities also where you private sector can fill somehow the gaps and support the administration, because it's a very specific domain, and rightly so, of course, as we want to keep the idea of public health as a key in Europe. So there is this need of providing support and having a dialogue with your national authorities.
Thank you. Yes, Michael.
I can comment on that as well, because I see there's two levels of support where we need to help all the vendors understand the legislation and the logical models it's described in the e-health network and extended EHR project. That's where all the requirements and the logical models are described. But I think the industry needs a further assistance in understanding the interoperable technical specifications. And in the EEHRxF we have this hub where we store all the documentation we collected in one place, so we can learn the vendors to use the interoperable fire standards, just to get it in the hands and try to physically implement it. Not even it's not sufficient you read the legislation and the implementation guides and understand what's in the paper. You need to try to implement it in some sort of hackathon. If you're in the fire world, you know what hackathons are. We have examples and adoption kits in the hub in the EEHRxF project, so you have access to all the material to actually get some practice. And I think each member state has an obligation to try to establish a sort of hackathon in each member state.
Thank you. A quick reaction as we need to wrap up. Yes, please.
Yeah, well, responding also to your question, I think there is a keyword that yesterday was also used, is co-creation at the end of the day. We talk a lot about co-creation in healthcare, let's say working with patients, but I think co-creation is at all levels. So as they were mentioning, the experience that you have that sometimes you don't know exactly what to do or what is needed is completely, I mean, it's like all the experiences that we have sometimes. And it's because I think this, for example, these forums, this experience to communicate with each other and to understand what are really the needs and how we can solve those needs, I think that is fundamental. Mentioning just a small part is just during these past months, there has been, for example, at the Spanish level, but also at European level, there have been open consultations about this kind of implementation, for example. DEDAS 2 was closed this Sunday, I think, and it was the opportunity as well to participate. And I think those kind of initiatives are fundamental. And sometimes from the private sector, we don't see that as a lot of use, but at the end of the day, I think it's really important. For example, Ametic was leading some of the answers at the national level. So maybe when you have perspective from different, let's say, industries and stakeholders within the industry, maybe that answer is going to have more, more attention from the government as well, and then you can participate in that way as well. It's not only, let's say, in the calls and trying to implement something, but also seeing what you are implementing, what are the needs that you think are worth it, the effort as well, and then also participate in this kind of open calls. For the private or for everybody really to get into, let's say, the solutions. So yeah.
Thank you. So mindful of time, that brings us to the end of the session. So please join me in thanking our speakers for such a practical and forward-looking discussion. And we've heard many different perspectives from different member states, national level, but also European level, the Commission's doing, and standardization work that is ongoing not only at EU level but also internationally. So please, round of applause for the speakers, and thank you for.
Okay, so thank you very much to all our speakers and to Gianluca for moderating this excellent session full of insights. We'll now move straight into the next block of discussion. For those of you staying in the Simón Bolívar room, our next session is Breakout B1, Defending Patient Safety, Cybersecurity as a Tool to Support Patient Journey. We'll start shortly, just after a quick room reset, and you may take advantage of the break for some stretching. If you're attending this session, Breakout B2, One Health in Action, Real-World Application, that session will take place in the Embajadores room, just across the hall. Our hosts are available to guide you if you need directions. Please take a short moment to grab a coffee, stretch, and we'll start again in a few minutes. There is no coffee, I don't know. Later. We'll grab later. Just stretch.